Hello everybody, welcome back to my channel. Today we are having another episode of Medical Grains, and today we are talking about anesthesia awareness. And this sounds like the shit of nightmares. So let's get right into it. So anesthesia awareness is a complication of surgery where the anesthesia causes the patient to be awake but unable to move, and they sometimes are able to feel what's happening to them, whether it be full feeling or just pressure or partial feeling, and they sometimes will have memories of what happened to them after they wake up after surgery. If this is not the shit of nightmares, I don't know what is. So it can be caused by not having enough the medication in your system, whether you have like a low cardiac reserve, if you have heart damage and they're trying to balance between what your heart can handle and what will keep you under. The person administering either a MD or a CRNA may not have enough experience or enough knowledge of all the medications, so they don't give you enough. This can also happen when they're switching syringes while the surgery is happening. It can also happen with poor staffing. So there's not enough people in the OR to help. They may have more time to get what they need and come back, so therefore you are a little less under than you were a minute ago. So lots of things can contribute to that. If the patient has a high drug tolerance, they can also have issues with not having enough anesthesia. If the patient, usually younger people tend to metabolize it faster, and so they may need a bit more. People who are obese or smoke can also have this complication. And also people with red hair tend to need more anesthesia than others. Some genetic factors also contribute to needing more anesthesia than others. I don't know why the red hair thing is a thing, but that's an interesting one. So some people will remember when they wake up the entire thing. They'll remember conversations that the staff were having. They remember the feeling. They will literally feel, they could feel everything. No pain relief at all. They're literally like screaming inside because they can literally feel you cutting into whatever it is you're doing. And that is like totally so frightening. Like, oh my god. And some people don't have so much memory, maybe like little snippets, but it can still be like so scary. Some of these patients will have PTSD after this experience, and they'll go through therapy. So there have been some cases that were discussed in the news where patients had this happen to them. They were going through treatment with their PTSD and trying to get therapy, and they did eventually just succumb to their illness, the PTSD, and just kill themselves, and it's really unfortunate. But this kind of thing happens, as even though I've brought up other patients, other examples in my other videos, I really didn't want to bring up this one in particular because these are just really tragic, and the person is really traumatized from this, and they probably have like no trust in the healthcare system after that, so they might even have a hard time seeking treatment because they feel like they've been so wronged by the healthcare system, which is completely understandable. Unfortunately, this kind of thing does happen, but it's a very, very rare complication. It's a very, very small chance that this would ever happen. It most often happens in like trauma surgeries or like emergency surgeries because everything is going so fast. They don't know any history of the patient. If there's something that would happen that needs emergency attention, they might not have a history of the patient, so they might not know anything about them, so they just have to kind of go with what they know as far as how much anesthesia to give. And there's so much more that goes into anesthesia. I don't know any of it because I'm not an anesthesiologist or a CRNA. So a CRNA is a nurse that is certified to give anesthetics, and most programs don't allow you to even work at all during the program because it's so intense. So anyone who's been able to get through that and graduate and get certified, they are probably like the smartest people on the planet. This happens to about 1 in 1,000 patients, which seems like a lot, but it also varies as far as severity. It could be very mild to where you may have been slightly awake, but you don't remember at all, you have no recollection, or you could have the most severe where you remember everything and felt everything. If you watched Grey's Anatomy, you might remember that the patient did wake up during surgery one time and her eyes were open and everything. I didn't find anything where that said that could happen, so I don't really think that could happen like her paralytic would have to be like totally gone too, because they give you a sedative and a paralytic. So even if your sedative wears off, you still have the paralytic to where you wouldn't be awake. Like, so I don't know how accurate that is. If you know anything about that, comment below. Okay, last thing I want to say is do not lose trust in the healthcare system because these videos, seriously, I don't want you to like panic and never have surgery ever again because this might happen. A book that was written in 1999 is called To Err is Human. And in this book it talks about healthcare in general, but in one section it does say how in that year, in 1999, anesthesia was like 50% more effective and more safe and more regulated than it was in 1980, which is only 20 years before this book was written. And that was 20 years ago this year. So you can imagine that it's got to be significantly more safe than it was even then to now. So the more that this kind of thing happens, the more we can learn from it and make changes, so that's better. So don't use this to not have surgery. If you're afraid of this, you should really discuss it with your doctors and the people who are on your healthcare team. So if you still need surgery, it's really important to probably get it if it's life-saving. So thank you guys so much for watching. I hope you enjoyed this one. I would love it if you left me a comment down below and liked and subscribed to this video because I am trying to build my channel. So hit me up down below. I would love to read your comments, and I'll catch you guys in the next one.